It's just a little prick, and nobody minds a little prick, do they? Hey folks, it's Finn. Welcome back, lovely people. Lovely to see you, and thank you for tuning in to another video. Today's video is all about testosterone, hormone replacement therapy, and I'm going to be talking about the testosterone that I'm on, as well as sharing some tips for having the injection and for aftercare. But before we get stuck in, for anybody who is new, a very big welcome. My name is Finn, and here on this channel and on my accompanying website, which you'll find in the description below, I create content on gender transition, LGBT life and mental health, including very frank content about lower surgery, top surgery. All of my content is very frank and honest. No holds barred. Barred! So if you enjoy my content and you haven't already, I would love it if you would subscribe, because it really does help my channel. Click that button. So I'm quite often asked about the testosterone I'm on, how long I've been on it, and the dosage and so forth. So I thought it was about time I made a video about that. So this is the testosterone I'm on. It's Nebido, and it comes in this little vial. Nebido is a long-acting testosterone, and it's an intramuscular injection, which means it goes deep into the gluteal muscle in your bum. Now, you don't do it in doses, you get the whole thing. This is 4 ml of 1000 milligrams of testosterone, and the way it's different is that rather than the dosage changing, the time frame changes. So you either have it every 10, 12, 13, 14 weeks, depending on your levels. I have been on Nebido now for 8 years. I was prescribed Nebido straight away when I first started testosterone back in 2013. Initially, I was on every 12 weeks. I think I started at every 12 weeks. And somewhere, I think about 2 years into my transition, my levels changed, they dropped a bit. So they brought the time frame down, so it moved from every 12 weeks to every 10 weeks. And I've been really lucky that my levels have just stayed the same. I seem to have just been one of the lucky ones that gets prescribed testosterone and my levels just sit at what's right for me, no problem. Now, one of the biggest benefits of Nebido is that it's long acting. So this means that, you don't have to worry about having it every week or every other week. It's just a few times a year. Mine's every 10 weeks. So that's roughly every kind of couple of months. And it just means you haven't really got to worry about it. And the other benefit of it being a long acting testosterone is that it's literally long acting like that. So you don't get the peaks and troughs that you might get with one of the shorter acting testosterone injections. And that was really important for me because I have a fluctuating mood disorder, and I knew that I couldn't handle any other emotional shifts as well. And I've never had a problem on Nebido at all. I don't really experience any issues. I can sometimes notice when my shot's about to be due that I start to get a little bit tired and start to feel a little bit off. And then when I have my injection, I definitely do notice an increase in just a bit of an awareness and kind of energy levels in the first couple of weeks. But it's very subtle. It's very, very subtle. And most of the time I'm just on an even keel and I don't notice. And I'm very glad about that. Nobody likes a peak and trough. To administer Nebido, I have a nurse do mine. I'm in the UK. And over here we seem to be quite different in terms of injections. Most of the time we are asked to have a nurse do it for us. But there are some people who do their own injections. But of course it's just a bit difficult with Nebido because it is such a lot of liquid and because of where it needs to go. So I'm actually quite happy having a nurse do it. Now, because this is a lot of liquid, it's 4 ml, it has to be done really slowly over a minute. And that's always a really key thing when having this done, is to make sure whoever is administering it reads that pamphlet and knows that this has to be done slowly over a minute. And in that way, it does lower the pain. Is it painful? This is a common question I get, and yes, it is. I mean, every injection is painful, isn't it? but Nebido can be particularly painful. And there are lots of things that we can do to try and lower the pain, but for some people, doesn't matter what they do, it's just painful. But it's worth it, right? But these are some of the things that I suggest trying, which have helped me, and I don't actually experience that much pain on my injections. I've got a really good nurse now who knows what she's doing. Sometimes I get a bit of stinging, but it's not much. So because this is a lot of liquid and it's very thick, one of the best things you can do is warm this up beforehand. The way I have this done is I order this on prescription, I pick it up, and then I take it to the nurse, and that means I can stick it under my armpit before I go, just for like 15 minutes, and make it really warm, and then that helps to make the liquid easier, more viscous, it's not quite as thick, and makes it injecting a little easier. It makes it easier for them to pull up into the syringe as well, so definitely warm this beforehand under there. Perfect. Also, try and warm up the injection site beforehand. So that means you need to warm your gluteal muscles up. And the way I do that is just a nice brisk walk to my doctor's surgery. That helps. But so do bum clenches. Just don't let people see you doing them. If I'm waiting in the doctor's surgery, I will sit there and just clench my bum cheeks back and forward a bit, just so I'm working that muscle to keep some heat in that muscle, because the warmer the muscle, the easier the injection goes in. So the warmer the liquid is and the warmer your bum muscles are, the easier it will be, and hopefully the less painful it will be. Now, when it comes to actually having the injection, people are very mixed on how they do this. Some people like to lie down, some people like to stand up. Now, I have stood up from the start, and the way I do it is whatever side I'm having injected, so say I'm having the injection in my right side, I will stand up, I'll lean and hold on to something, and then just take my weight completely onto my opposite leg and let the leg that's been injecting just go really limp, so that it's just doing nothing. You know, put my toe down so there's just no weight on that foot at all, and then that's fine for me. But other people find that they lie down. I tried lying down once and had so much pain after the injection that I vowed never to do that again. So if you're just starting out on your journey and you're on Nebido, speak to the nurse and just see if you can try different ways of doing it. But the most key thing is taking all of that weight off that muscle, because you want that muscle there nice and loose. So you can do that by lying down, or as I say, by holding onto something and just shifting your weight. But first time you're having it done, might be best to lie down, because some people do have a reaction. Some people faint. You know, these things can happen. So if it's your first time, perhaps try lying down and then experiment over time. It's very key with this is to keep experimenting and finding ways that work best for you. I find that as the liquid is going in, it's very slow, it does sting. But then, as I say, I'm not too bad afterwards. In terms of aftercare after the injection, I am lucky, as I say, that I don't tend to get much pain. Every now and again, even if I do all the normal stuff I do, I'll just have random pain. It's really strange. Sometimes bodies just do this. But I'm quite lucky and I don't get a lot of pain. I just get a bit of stinging, which kind of comes and goes for about 24 hours and then it disappears. But my aftercare is to keep moving. I walk back from my doctor's surgery after having it done and perhaps go for a little walk. I do notice if I sit immediately afterwards and don't move, like if I'm working or if I'm travelling, then actually sitting on that site can cause more pain. So I try and keep moving, that always helps me. I also apply heat to the area. Now, you can use ice or heat. Most commonly people say ice, but I always find that heat helps me. Again, it's whatever works for you. So I have a little mini water bottle for if I'm travelling, or a heat pad if I'm travelling, and I just put that on, just over my jeans. Don't put it directly on the site. Just warm enough that it just keeps that area warm, and then that seems to kind of help the muscle to relax and for it all to kind of go in and dissipate and what have you, and that's fine. So that's all I tend to do. Have a little bit of a walk, put some heat on the area, and then it's fine. By the next morning, I don't know I've had it done. Other than the buzz that I get every single time, even at 8 years on T, of having my injection. It's just that lovely kind of knowing that, yes, I've still got testosterone flooding my veins. A common question that's often asked is about massaging injection sites, and it's a strange one this. There's lots of different theories about this, but I would always say don't massage it, because what happens if you rub and massage that gluteal muscle, what you are doing is you're pulling the Nebido, the liquid, out of the muscle into the subcutaneous tissue. Now, although there isn't generally a problem with this type of injection, because the Nebido is just as well absorbed whether it's in the muscle or in the subcutaneous tissue, more nerves are in the subcutaneous tissue. So if you're pulling it back out, you're actually going to feel more pain in that area. So don't massage it. Just walk, put some ice, put some heat, and it will eventually stop stinging. I really hope that was helpful and helped to alleviate any fears you might have about having the injection, or perhaps pass on some tips to anyone who's had it and is having some problems. If you have any other questions about testosterone and injections or about anything else, then please do pop me a comment in the section below. Always happy to help. Thanks so much for watching, folks. If you enjoyed this video, please do give it a thumbs up. If you'd like to support my content, I have loads of really awesome membership options, which I shall link in the section below. And if you have enjoyed this video, then don't forget to check out all my other content as well, all in handy playlists. Thanks for watching, folks. Take care of yourselves, keep on keeping on, and I'll see you next week.